Okay, today I'm going to show you how to tape the MCL, your medial collateral ligament of your elbow. So not the knee, the elbow. Now, this ligament helps you or stops you going that way. Okay, it's like a valgus direction. So I'll show you just a bit of a quick anatomy rerun. This is your ligament here. So it goes in like a triangle like this. So this part, it's sort of like three parts. There's a transverse component here, you've got an anterior portion, and you've got a posterior portion. So it's actually like that sort of triangle. So we're going to cover that just like we would do for a knee, but there's a couple of little tricks. Now, we're going to use three different tapes. The first one is an underwrap. We need that, one, for sensitive skin, but two, because the elbow has got skin that moves quite a bit, right? We need to add on a little bit of security, a bit of tape underneath. So the brown tape, which we're using second, which is actually the tape that's going to do most of the heavy work, has something to stick to. All right, and then we're going to overwrap it. Now the overwrapping is an elastic EAB. This is great, it's like a crepe one. This one is to add more reinforcement. It makes someone who is, say, returning to sport a lot more confident, gives them way more security on top of this, and we'll show you how to do that. Let's start with the underwrap. So what I like to do is add it on in the same direction where I'm going to be putting the brown tape. So put on your anchors first. So you're going to do one on the top, one on the bottom. Now these need to be pretty light. So you're not trying to make this stiff around the arm. We're just going to basically use it, one, to cover the skin so we don't get any irritation, but that's what the brown tape is going to anchor onto rather than the skin. So it just gives another layer of reinforcement. So top and bottom for your anchors. Then we're going to put the underwrap over the medial collateral ligament and in a direction where, if you look at where that direction is there, where that tape is going to go. So I like using a bit of an X type pattern. Again, it doesn't have to be super tight, but you don't want it really loose. You definitely don't want any crinkles in this. And it doesn't matter if you overlay the tape a bit more, because it'll just add to the reinforcement. So we want to go, and that, see there's an X there now? That's sort of basically covering my transverse, it's covering my anterior portion in the same direction as the fibers. And of course it's going to cover the posterior at the same time. So what you want to do is make sure all the skin is covered with this, especially for those people who have got hypoallergenic or sensitive skin. They're the ones that need most of it covered up. And you can come over, like overlay the previous layer if you like, if you don't want to go too wide. As long as you've got most of that covered. And like I said, if you've got people with sensitive skin, if you go over, you're going to have to do a little bit more. But that's going to be enough for our anchoring down. So this tape here is going to be solid. So with your rigid, this is a 38mm standard serrated edge, so you can rip it, sports tape. And I'm going to go and redo my anchors. So the first thing you're going to do, put it around top and bottom. Again, can't be super stiff and tight, because you're not really, you don't want to cut off any blood flow here. You're just acting as an anchor point here, so it stops moving on the skin. Same at the top. Be careful not to go too tight with this. Just firm around through there. Okay, just as a heads up, if you become a member of this channel, you can get exclusive access to the exact exercises that we give our clients here in the clinic, with the exact cueing, instruction, technique correction, so you can get your rehab done right. We're uploading over 700 of our new videos, so head to the members area and check it out today. With this one especially, what you may need to do is ask that person to sort of tense the bicep and the tricep and then put the tape around, otherwise it can tend to cut in once they're playing. So just make sure that you've got that correct. And then you're going to aim to overlay your stripes. Now the good thing, what I've done, you can see how I've gone in the right directions there. So I'm going to follow that, and that'll give me the right amount of support in the right directions. Now, first one, anchor it down, measure it out, then I tend to rip it off, and then pull it back. And then what you're going to do, keep the elbow, see I've got it in a bit of a flex position, I haven't got it sort of straight fully, I want it in a little bit of a bent position. So from that point, I'm going to hold the anchor and then just really firmly push that down, trying to keep any crinkles out of the tape, like that. Now I'm going from proximal to distal with the first layer. On the second layer, I will come back and do the reverse. So this one here, coming over, making sure you're covering that ligament. It doesn't matter if you don't get it fully because your second layer is going to overlay the first one and by half. So again, you might want to cradle that whole arm. Make sure too they're not getting pushed into valgus, so you've got to keep it in a bit of varus there. Hold it down. Make sure that is all pushed down correctly. And then come through with a straight one. So make sure this straight one you cover over that medial epicondyle because that's one of the anchor points of the ligament. There you go. So now that's your first layer. Second layer, think of going over top of it. Now depending on where you went, if you were this side, so more anterior or more posterior on the ligament, you then go over by about 50% of the original taping. Okay, so I'm going from distal now, coming up, hold that, a little bit of flexion, crank it up, and then down over to the proximal part. Second one, over it goes again. You see I've got a little bit high there, but that's okay. But if someone who has got sensitive skin, you want to make sure the white's underneath. Then your straight one. And crank that up nice and tight through there. Now, I would lock that off before you put the AAB on. Just make sure, again, this is nice and light because you've been really cranking this up. Don't fall in the trap of then cranking the anchors up. You don't need to. Plus, it's too uncomfortable if you do. Especially this one here. And this is where you might need to get them to tense again. See if you can get a bit of muscle tension to pad it out and thicken up that area. And then you just come over it really gently because you don't need any tension on those ones, all right? Now, that's your standard taping. Now, really good for someone who's had a medial ligament injury, say acute, they need a bit of reinforcement, maybe they're just going to work, doing things, they're not playing sport. But if they are returning to sport, and this is, say, a non-acute injury now, but they still need protection, you'd still do the same thing here, exactly the same, but you're going to add on this. Now, depending on the size of the arm, you could use a 75 like this, you could use a 50. Trick with this stuff is making sure you tension it as you go. So start off with an anchor point like that, and you can just wrap around to get yourself going. But you come down, once you've got an angle there, you come down on the same angle and cover over it. And then when you come around, tighten it as you go, making sure there's no crinkles in it as you wrap around. Your first one's usually the hardest one, once you've got that right. Then, when you come around here, you wrap around twice, okay, like that, and then come back around and come up. It doesn't really matter which way you start, as long as you are overlaying, almost like reinforcing the current taping you've got. Get it all perfect through there. Then you come around again. This needs to be just light through here and then come back over. So when you come back over, cover what you haven't gone over by about half again. Now, depending on how much sort of stability you need, will depend on how many times around you're going to go. So around you go again and then come up. Now I've gone sort of down on that one and I've gone down on this one below what I currently did. And then I can add on, that could be enough, or if I feel like I need a little bit more, wrap it around again one more time, and then I'm going to come above it. So sort of crossing over. So you'll notice because you really cover the entire thing. And when you come back up, I'll come around the top. Just as long as they can still functionally use their arm in sport. Being a strainer, it might look a bit overkill, but trust me, this is great. Wrap it off, lock that off. And then you've got a really firm taping for that medial ligament, which helps reduce the amount of force going that way, protects the ligament. See how you go with that one. We'll see you next time. Now, if you are struggling with your rehab and you need specialized, structured physio exercise rehabilitation programs for your injury and surgery, then do yourself a favor and head to physiorehab.com or click on the website link in the description below. If you like the content on this channel, then hit the subscribe button, because the bigger the channel gets, the more free videos I can put up for you to watch.